And my topic is eosinophilic esophagitis. What is eosinophilic esophagitis? Also known as allergic esophagitis, is an allergic inflammatory condition of the esophagus and involves eosinophils, a type of white blood cells. Symptoms are swallowing difficulty, food infection, vomiting, and heartburn. Vomiting.
What is eosinophilic esophagitis? Eosinophilic esophagitis, or EOE for short, is a type of food allergy that affects the function of the esophagus, the tube that connects the mouth and stomach. EOE occurs in both children and adults and involves severe inflammation of the esophagus, resulting in problematic function of this important part of the body. Patients with EOE can have various symptoms that can include vomiting, pain, difficulty swallowing food, and growth issues. EOE is diagnosed by examining tissue samples of the esophagus. These small pieces of tissue, called endoscopic biopsies, are collected from the esophagus wall in a short procedure called an endoscopy, where a thin tube is inserted through the mouth to look into the esophagus while the patient is under anesthesia. The collected samples are then examined under a microscope by a doctor called a pathologist, who looks for and counts a type of immune cell called an eosinophil. Eosinophils are white blood cells that are normally found circulating in the body. However, in EOE, these cells collect and build up in the esophagus. These cells cause tissue swelling, inflammation, and damage. The diagnosis of EOE is made when there are 15 or more eosinophils found from microscopic feces in biopsy. And EOE is a complex condition. It is best managed by a multidisciplinary treatment team that includes gastroenterologists, allergists, and dietitians, with all treatment decisions being made in partnership with patients and families. EOE is a chronic disorder that can flare up or go into remission, and unfortunately is a lifelong condition. EOE can be successfully managed with medicines and dietary therapies. The most common medicines used to treat EOE are called glucocorticoids, a type of steroid that counters inflammation. Dietary therapies involve avoiding the foods that cause the inflammation and disease flare-ups. Ongoing research efforts are improving diagnosis and treatments for EOE and give hope for better treatments and an eventual cure.
Medical application. Eosinophilic esophagitis can produce the following: scar in the esophagus and narrowing of it. This causes difficulty in swallowing and increase the likelihood of food getting stuck, and damage in the esophagus. Because of the inflammation of the esophagus, endoscopy can perforate and tear the tissues that cover it.
Imagine getting food stuck in your esophagus all the time.
People live with that, but that's not normal.
It's called eosinophilic esophagitis, or EOE. According to Mayo Clinic's Dr. Jeffrey Alexander, it affects roughly 1 in every 2,000 people and is becoming more common.
It's probably a little more than that. We're seeing the prevalence is higher than we thought before, and we're seeing the incidence, the number of new cases discovered, appears to be significantly increasing over the past 20 years.
Dr. Alexander says it's actually a food allergy.
But over time, this disease can lead to scarring down of the esophagus and narrowing of the esophagus, and then swallowing problems become more consistent.
As Dr. Alexander and his colleagues at Mayo Clinic work to find better treatments, the question remains why EOE is becoming more common.
We don't know why. I would say allergic diseases as a whole are increasing in our society, and we don't have a good explanation for why this is occurring other than that.
For the Mayo Clinic News Network, I'm Ian Roth.
EOE in Ecuador. In 2018, a study identified an area of low prevalence with centers reporting a low number of cases in Central America and Mexico. in the Andean region, like Peru, Ecuador, and Bolivia. In conclusion, the prevalence of this disease in Ecuador is actually low.
Eosinophilic esophagitis is a relatively newly described disease. It was reported really 15 to 20 years ago. It is an allergic disorder that affects not the outside but the inside, so the food pipe or the esophagus, and that's really where this inflammation is limited to. We consider it something that is clinical, meaning the patient has symptoms that brings them to the doctor. And also, when you actually look at the tissue or the affected area under the microscope, you see inflammation there. So the combination of the two things combine to create this disorder. It is called eosinophilic esophagitis because an eosinophil is the type of white blood cell that causes the inflammation in the tissue. It is that cell that is looked at under the microscope and counted to see the extent of the inflammation in the area. Eosinophilic esophagitis is also called EOE for short, for an abbreviation. EOE is diagnosed based on the symptoms that bring the patient into the office, and in different age groups there are different symptoms. So it can be an infant who's not feeding well, to a child who's vomiting, or even an adolescent who has heartburn type symptoms. And when they come for evaluation, other disorders are investigated as well, but ruled out. So perhaps you thought they might have reflux, and they were treated for reflux disease, but didn't get better. Perhaps something in their history suggested this, so they were having some difficulty swallowing, or when they felt that they would eat, they would feel something would get stuck and they would have to drink to let it down. That suspicion leads you to perform an endoscopy. And the endoscopy, an endoscopist, which is a gastroenterologist, would look with a fiber optic camera into the gastrointestinal tract and examine all of those areas and sample pieces of tissue with a biopsy to look at under the microscope for the presence of these cells. The way we treat EOE here at the CADC involves a large multidisciplinary team approach. You have the medical providers, the gastroenterologist, the allergist, in addition to a nutritionist to help guide and make sure that the patient receives all the nutrients that they need for growth and development. These are children that we're considering. We may need the aid of a social worker to help establish regulations or things in the school that the child may need if they have to stay away from certain allergens, be on special diets. I also work with, in the CADC, speech and language pathologists. Some infants and young children have feeding problems that they need to have addressed. And lastly, we also employ what's called a patient navigator. And a patient navigator is exactly what it sounds like, someone to help the patient navigate the system. You know, we write prescriptions, we make appointments, but it can be very overwhelming for a parent caring for a child with a chronic illness, and this navigator can help facilitate those appointments and make sure that all the needs of the families are getting met.
Pros and cons. Pros. Dietary treatment can be effective, as there does appear to be a role of allergic in the development of EOE. In the cons we have that no medications are currently approved by the United States Food and Drug Administration to treat the EOE. There are drugs used only to reduce the symptoms. Allergen-driven, sometimes it's really hard to detect what the actual allergens are that are causing it. We think of allergy in the sense that you can do a blood test and find an antibody
that's triggering an allergic response. But in this disorder, you don't always have that correlation. It is not classically triggered by those same antibodies that you think of someone having an allergic reaction that would get difficulty breathing or hives on their body. So treatment really can revolve around a few different areas. Number one could be diet. So even though we don't know specifically all the time what food or foods are causing the disease, we may try different diet eliminations of most common allergens that are known to affect children, to eliminate them completely from the diet and see if that helps. On the other hand, there may be people who test positive on allergen testing for hundreds of foods, and in those situations you may opt to do what's called an elemental diet, meaning you remove all of the food proteins from the diet and you supplement them with a specific type of formula. Once you do some intervention, you may need to then go back and do an endoscopy to look for response in this inflammation. Medication treatment options are also available for EOE. Topical steroids are medications that traditionally were actually used for asthmatics. They were inhaled steroids. We use them a little differently, and instead of breathing them in, you actually swallow the medications, or you mix them in a little bit of a slurry and take it down on a spoon in order to coat the esophagus, which is the inflamed area, and give it some relief that way. So it decreases the inflammation. They're known to work very well, but when we think about this disorder, we also have to take in mind that this is something that's considered chronic. So EOE is a chronic disorder, which means it's lifelong. And we discussed how this may be a fairly new diagnosis. So the things that are still unknown are what are the long-term effects of these type of treatment options. Topical steroids aren't the only medical therapy, but a lot of the time some significant steroids, so for example prednisone, is really reserved for when you have significant disease that may be a hospitalized child or someone who has a distinct complication from the disorder and requires it. Lastly, there's endoscopic interventions. So as a potential complication from EOE, the esophagus can become rigid or narrowed and needs to be opened up. So in certain situations where it may not respond to medical treatment, you may have to have an endoscopic intervention to expand the esophagus back to its normal size. I believe that here with the CADC and New York Presbyterian that we really care for the individual patient. We pay attention to their needs. We look at the most cutting-edge research in order to give our patients the best possible care. And that's really what we strive for on a day-to-day basis.
In conclusion, EOE is a complex disorder. It's important for patients to listen to their gastroenterologist and advice on managing EOE and figuring out when endoscopies are needed to check to see if the condition is getting better or worse. Patients also need to work closely with their allergist and immunologist to find out if allergies are playing a role.